It's a treatment almost as painful as the condition. Fatima Rashid, a Syrian refugee from Hama province who now lives in a camp in Lebanon's Bekaa Valley, receives weekly injections at this nearby hospital. She suffers from cutaneous leishmaniasis, also known as the Aleppo boil. The disease causes disfiguring skin lesions, often on the face and hands. Yusuf Hamoud and his 7-year-old niece Jahan also received treatment here. They escaped the fighting in Aleppo 5 years ago to a nearby camp and have been struggling with the condition ever since.
We are already suffering as refugees. We lack the basic necessities. We live in tents and are surrounded by garbage. It's an unhealthy environment. Now we have this skin disease that we are suffering, as if we need more pain and stress in our lives.
The Aleppo boil is a parasitic disease that was first reported in the northern Syrian city in 1745. For years, doctors have been able to contain the condition, which is spread by sandflies. But since the start of the Syrian conflict in 2011, it has re-emerged as a public health threat that doctors warn could reach endemic levels. The Syrian conflict has created what doctors describe as the perfect conditions for an outbreak like this. As the fighting intensified, hospitals were bombed and attempts to contain the disease were abandoned, leaving health workers little choice but to focus on those war casualties rather than those suffering from this disease. The disfiguring disease is not unique to Syria, but as millions of Syrians fled the fighting to neighboring countries, it began to spread rapidly. Cases have also been reported in refugee camps in Jordan and Turkey. In all, since the start of the Syrian war, doctors have reported around 10,000 cases. Treating those suffering from the disease is a challenge. It requires regular doctors' visits and constant testing, something Syrian refugees can't always afford. The prescribed medication can also cause serious side effects.
The injections we give may cause heart, kidney and liver problems. That's why we usually do blood tests for the patients every week. It's important to check on the health of their liver and kidney, otherwise they will face serious problems.
There's research into safer treatments and vaccines for the Aleppo boil, but it's limited. Because it's not fatal, it hasn't been a priority for infectious diseases researchers. But for those suffering like Yusuf and Jahan, a cure can't come soon enough. Imtiaz Tyab, Al Jazeera, Baalbek in eastern Lebanon.